name's Kate, and for my educational infomercial, I'm going to be talking about alcohol, along with its effects on the body, its risks, and some resources to help those struggling with abuse. To start off, the lethal level of alcohol is between 0.4 and 0.6%, but once you are 21, it is illegal to drive once you hit 0.08%, and that is also known as your BAC, your blood alcohol content. This number can be affected by many things. Some of these include your weight, your sex, medication, along with other things listed. Another fact, alcohol is the most consumed drug in the world. Its deaths outnumber deaths related to other drug abuses by a ratio of 4-1. Some of the effects I'm going to be talking about are those on the brain and the central nervous system, the endocrine system, blood, and the digestive system. To start, the brain and the central nervous system, a little fact that I found was that every part of the nervous system is affected by alcohol. So in low to moderate doses, we see disinhibition, which is odd behavior, inappropriateness. In higher doses, we see alcohol depressing the cerebellum, which causes slurred speech. And we also see impairment of simple tasks like decision-making and complete unawareness. When alcohol is seen in extremely high doses, it can result in death due to the depression of the respiratory centers of the medulla. Alcohol alters the production and functioning of transmitters such as dopamine, serotonin, GABA, and brain endorphins. This means that consumption can aggravate a lot of mental disorders that can be underlying. It can cause damage to the brain, central nervous system, peripheral nervous system, and can cause things like seizures and need for emergency care. Next, the endocrine system. If you don't know much about the endocrine system releases hormones into the bloodstream, and then it tells our body basically how to function. So when we add alcohol into these super important functions, we see an influence in the production and release of hormones. It affects endocrine regulating systems in the hypothalamus, pituitary, and gonads. In men, we see a decline in testosterone, which can lead to sexual impotence, breast enlargement, and loss of body hair. And in women, we can see menstrual delays, ovarian abnormalities, and infertility. Next, the effects on blood. When we see high concentrations of alcohol, we see lower effectiveness in our blood building system. This means we see a decrease in the production of red blood cells, white blood cells, and platelets. When we see this, we also see clotting and lowered immunity, and this can result in getting sick a lot easier and a lower resistance to disease. We also see heavy drinking affecting bone marrow. The suppression of the bone marrow can contribute to anemia, where red blood cells cannot keep pace with the need for those cells. Heavy drinkers are also likely to develop alcoholic bleeding disorders because there's too few platelets and we can't form clots. Lastly, the digestive system. The purpose of the digestive system is processing and digesting foods and liquids. When we add alcohol into this, it can irritate tissue, and then this tissue that lines our organs can cause acid imbalances, inflammation, and gastric distress. So we can see from this heartburn, gastritis, which only really occurs chronically in about 1 of every 3 or 4 heavy drinkers, but the more frequently we see consumption, the greater we can see irritation. Prolonged heavy drinkers suffer the risk of developing a lot of different diseases and disorders. These can include cancer in the mouth and the esophagus, ulcers, hernias, cancers throughout other parts of the digestive tract, and then we also see pancreatitis and potential diabetes. Some of the risk of moderate consumption, so what people may call tipsy, or if someone knows their level is just, getting to the point where they're feeling something, we see impaired eyesight, slow judgment, lack of coordination, and loss of balance. But when we see overconsumption, we can see things like blackouts, but when it gets to the point of repeated abuse, we can see things like death, organ failure, and cancer. Some resources, if you are struggling or know someone struggling, are the Substance Abuse and Mental Health Services Administration that can be contacted at 1-800-662-4357. And then I also attached links to Alcoholics Anonymous and support groups that you could find in your area to help you overcome this disease. And these are my sources. Thank you so much for watching.